So in short, every difference or all the differences in health outcomes by socioeconomic background, by gender or by age, for example, these are all reflections of health inequalities. And when we look at Europe, then we see that overall total life expectancy at birth, for example, has improved across all countries. But then we have two notions of health inequalities. One of them is that we observe differences between countries. So for example, in most Western European countries, total life expectancy is higher than in Eastern European countries. And the second way that we understand health inequalities is within nations. So what we also see is that, for example, when we look at measures such as self-reported health, we observe that individuals with tertiary education or higher levels of education, they tend to self-report better health than individuals from lower levels of education. And these are reflections of health inequalities. So I would say that overall we do observe health inequalities all around the globe. So it doesn't really matter whether it is a developed or developing country as such. But then of course, like the policy space available to governments, the resources that they have to address these health inequalities, these are definitely different. And then we also see that there are differences because of the policies chosen. So for example, when we look at labor market policies or when we look at social spending, we see that advanced nations have more resources, so they can afford to spend more on social benefits, whereas developing countries, they might prioritize different elements of economic policy, and as a result, that also affects health inequalities.